My case study on SPECT imaging for myocardial perfusion, a real-time clinical case. This case study is based on the nuclear imaging system, specifically the use of SPECT, a single photon emission computed tomography for evaluating myocardial perfusion. First, let me explain the patient details. The patient was a 62 years old male who presented with chest pain and breathlessness for the past 2 months. The patient had important risk factors including hypertension and type 2 diabetic mellitus. The ECG showed no significant changes, however, the treatment test or a TMT was positive for HMIA. The patient's left ventricular ejection fraction was around 45%. And the main problem was to evaluate whether there was by reduced blood flow to the heart muscle, especially during stress. Detect myocardial perfusion defects, determine the extent and severity of ischemia, assess myocardial viability. So, SPECT myocardial perfusion imaging was selected as a suitable non-invasive investigation. Now, coming to the methodology. For the study, technetium 99M system, commonly called TC99M system, was used as the radio tracer. The study was performed in 2 stages. First is the rest study, second is the stress study. After each injection, the patient was positioned properly and images was occurred using the gamma camera. Gamma camera system. Now, I would like to explain the gamma camera used in SPECT imaging. The major components include the collimator, scintillation crystal, photomultiplier tubes, positioning, circuitry, and computer system. The collimator allows radio gamma rays traveling in a specific directions to reach the data, and crystal converts the incoming gamma radiation into light. The positioning circuitry determines the location of the detected radiation, and finally, the computer system process and reconstruct these signals to produce the SPECT images. Now coming to the results, the SPECT images showed a reversible perfusion defect in the anterior and the antiseptic walls. A reversible defect means that the blood flow is reduced during stress but improves during rest. This indicates inducible myocardial ischemia. The findings suggested ischemia in the lat or left anterior descending artery territory. The inferior and lateral wall showed relatively normal perfusion. Quality control is very important in nuclear imaging because accurate results depending on proper gamma camera performance. This confirms that the gamma camera was performing properly during this study. Finally, to conclude this case, demonstrate the importance of SPECT myocardial perfusion imaging in detecting inducible myocardial ischemia. In this patient, the study identified a reversible perfusion defect in the anterior and anteroseptal regions. Therefore, proper patient preparation, radioactive administration, image acquisition, reconstruction, interpretation, and regular quality control are essential for obtaining reliable SPECT results. Thank you.